Patient Protection and Affordable Care Act was signed into law in March of 2010. But how exactly does this Health Care Act work? How is it funded? Where does the money go? What are the key provisions to the law? What are its benefits and criticisms?
The key provisions are minimum standard. Policy must meet a minimum standard called essential health benefits. Guaranteed coverage. Health insurers cannot deny coverage based on current or previous health. Healthcare quality. New programs to develop community health teams supporting medical homes to increase access to community-based coordinated care. Low-income subsidies. Individuals and families that make less than 400% of the federal poverty level who purchase insurance through an exchange will be given subsidy from the government. Individual mandate. Everyone is required to purchase a health insurance unless you qualify for an exemption, otherwise pay a penalty. Coordination with affordable insurance exchange. Individuals and families can apply for coverage using one application and have their eligibility determined for all insurance affordability programs. Medicaid expansion. Increase in Medicaid income threshold, which is used to determine if an individual or family qualifies for the program.
The PPACA is of course funded like most government plans, and that is through taxes. The ACA uses federal and state tax dollars. It uses a mixture of taxes, penalties, subsidies, and cost contracting measures to fund the Health Care Act. It is described as mostly self-funding, meaning it's new spending that is offset by cost curbing and taxes. Some of those increased taxes and cost curbing measures are a 9% increase in Medicare tax rate, a 3.8% new tax on unearned income for high-income taxpayers, a new annual fee on health insurance providers, a 40% new tax on health insurance policies, a new annual fee on manufacturers and importers of branded drugs, a 2.3% new tax on manufacturers and importers of certain medical devices, a 2.5% increase in the adjusted gross income floor on medical expenses deduction, a limit annual contributions to $25,000 on flexible spending arrangements and cafeteria plans. Those who make a higher income pay a higher income tax. Part of that goes as subsidies towards those with smaller incomes to help fund the Affordable Care Act. Another way it is funded is via a penalty tax, which is issued if a person who can afford to have health insurance but chooses not to have it. That tax, like other ones, go towards healthcare spending on ACA subsidies, Medicare, Medicaid, and other federal and state healthcare programs. So the PPACA is funded via a variety of taxes.
The money is then used to expand Medicaid to assist those under 65 who are in poverty, provide tax credits to those who receive health insurance from the state due to ineligibility, create cost-sharing subsidies to reduce out-of-pocket costs for individuals and insurance companies, sets aside money in an insurance pool for the medically uninsurable, and pays back the government agencies for processing the new work they have.
Benefits and criticisms of the law. Government. This criticism claims the PPACA moves healthcare in the wrong direction. It puts government, not patients, in charge of individual healthcare decisions, or the IRS if not complied with. Criticism because seen as overuse of federal power. Healthcare services under the Act are provided by private physicians, hospitals, and insurance plans, not government-owned and operated entities as they would be under a socialized system. Availability and pricing of plans is based on competition in the private sector marketplace, rather than by government price setting. The ACA does not dictate what kind of treatment an individual will receive. It simply sets minimum standards for essential services that must be made available. This is a benefit because it is society-based. Economic activity. Slows healthcare spending that translates to more money in taxpayers' pockets since federal and state governments are able to cut their projected spending on healthcare. These changes are due to rewarding providers for providing good care rather than seeing large numbers of patients and penalizing hospitals that have high readmission rates. The wealthy will benefit from the ACA just as much as the poor and middle class because when spending goes down, so do taxes. Reducing the federal deficit, which is good for taxpayers at all income levels, and more jobs as employers feel less burdened by the cost of covering their workers. It creates new bureaucracies that will erode doctor-patient relationship. The trillions of dollars in new spending will place a massive fiscal burden on future generations of taxpayers. To get the money to help insure all these people, there are new taxes, mostly on high earners in the healthcare industry. Coverage and companies. Insurers can manipulate raising premiums and coverage, and people are still uninsured. The ACA was never designed to provide universal coverage, even with the expansion of Medicaid at a state choice. And the coverage is not for those who need it most. Young people tend to be healthy and not to need coverage as often as older Americans. Yet young people have some of the best deals of everyone under the ACA when purchasing care. Doctors are retiring, whole healthcare providers are shutting down, policies get canceled or cost more due to the insurers' narrow networking. There are more private coverage options, and all major medical coverage must provide minimum essential coverage. You can't be dropped from coverage when you get sick or make an honest mistake on your application. You can't be charged more for being a woman. And other protections that ensure that you have the right to a rapid appeal, the health insurance companies can't make unjustified rate hikes, and that these companies must spend a majority of premium dollars on care, not paying executives. Down to business. The employer mandate states that starting 2015-2016, businesses with the equivalent of more than 50 full-time employees must provide health coverage. Businesses have cut employee hours to avoid providing full-time coverage, adding extra operation costs to businesses that did not provide health insurance. Many lower-wage employees will find health insurance unaffordable and end up with no affordable options due to having been offered coverage through work previously. Ta-da!